7:23 in Trinidad and Tobago. Well, the World Health Organization is commemorating this year's World Health Day with a focus on diabetes. Its theme, Let's Beat Diabetes, will throw the spotlight on the disease and its treatment as well as its prevention. Well, we're now joined by County Medical Officer in the Health Ministry, Dr. Maryam. Thanks very much for rejoining us. The last time you were here, we were talking about Zika and all of the issues associated with that. Let's talk about the broader issues now of health, and referring to diabetes. We got some information, I think, from the World Health Organization yesterday about the quadrupling of diabetes globally over the last 35 years. What's our situation in Trinidad and Tobago?
Well, actually, our statistics corroborate with those of the World Health Organization. In 1980, the prevalence, that is the rate of diabetes amongst our population, was at 4%. Now it's actually 14.5%, which represents a 350% increase in the number of persons who have diabetes.
And so that's basically, you're talking about almost 1 in 6, 1 in 7
yes.
in the entire
yes.
population with diabetes. What challenges does that represent as far as the health complications later on in life?
Well, there are two sets of complications. There are the health complications, which really represent areas such as kidney failure, blindness due to what we call retinopathy, where the small vessels in the eye are damaged. There's a link with heart attacks and strokes, and then there are the societal impacts and complications, because of course if you're diabetic and you have, let's say, an amputation or you are hospitalized for a long while, your quality of life and your ability to earn is significantly decreased.
And we're talking about so many different issues when you talk about these lifestyle illnesses. Just so I can understand clearly, is diabetes classified as a lifestyle illness in that sense?
Yes, it is, because the factors that really cause diabetes can be attributed to one's lifestyle. Diabetes is also exacerbated by lifestyle factors. So it can be prevented by adopting a healthy lifestyle, and it also can be treated with the use of lifestyle interventions and medication.
So let's talk about that, because the theme is Let's Beat Diabetes.
Yes.
So bottom line, how do we beat diabetes?
Well, the first aspect we have to look at is the primary prevention of diabetes, and that can be done by adjusting our lifestyle factors. Given the high prevalence of diabetes in our population, as you said, 1 in 6, persons should really assume some sort of individual responsibility for their health status. In keeping with this, persons should really adopt a healthy lifestyle, which involves 30 minutes of cardiovascular exercise at least 5 days per week, a reduction in foods with high sugar content, high carbohydrate content, the cessation of smoking, very moderate alcohol use. And these measures also apply to persons who have diabetes. As well as that, persons with diabetes need to visit their family care physicians or their primary care physicians on a regular basis and have the relevant testing to identify if complications are occurring.
And we talk about diabetes, let's just try and separate it a little bit as well and talk about diabetes in children, because
yes.
that seems to be an issue that is becoming more and more prevalent, worryingly so. Do we have any data at all in Trinidad and Tobago to support concerns about childhood diabetes?
Well, we have data regarding the increase in obesity,
yeah.
which as well has gone up significantly. It's at about 11.9% at this point in time. And that represents, again, a tripling of the incidence or prevalence of the disease in our country. Obesity is one of the main risk factors in the development of diabetes. And so we expect and anticipate to see a higher number of children with this disease.
And are there any specific initiatives? Obviously, we're talking about exercise and diet and so on as well in children, but getting that message across seems to be the major challenge, because, and I know we're going into the area now of economics and businesses selling all of these sugary drinks and sugary snacks. Parents saying, for example, well, to get healthy food, it costs so much, takes so much time, which they don't have because they have to get the children to school when they come back home late, and it's easier to walk into the grocery, buy the cheapest junk food and put it in a bag and hand it to the kids and so on. It seems to be what you're recommending is common sense, exercise, healthy eating, lifestyle choices, but with the realities of life, people seem to be saying that, look, it's not as easy as that.
Well, I agree with you, and the largest or the biggest challenge that we have faced as health practitioners is really implementing some sort of initiating behavior change in our population. We also at our primary care level do have the assistance of allied healthcare workers such as medical, social workers and psychologists to assist persons who require help for stress and anxiety, which are also causative factors that can worsen diabetes. We try to encourage parents to really look at their diet choices and to really start planning. We agree that the cost of certain vegetables and organic food, etc., is really restrictive at times, but in terms of looking at what can be afforded at the relevant time, for example, during certain seasons, certain vegetables are a lot more cost effective than others. We really encourage parents to look into those sorts of options.
And is it a case of, as we're talking about World Health Day and the focus on diabetes and beating diabetes, is it about getting that message across through much greater levels of public awareness to almost combat the other message about buying all of these snacks and all of these sugary foods? Is it more about public awareness than anything else?
Yes, health education and health promotion has been a major target for the Ministry of Health. Our health education drives really stem from giving awareness from the primary school level to general awareness, which could be done at health fairs and partnerships with corporate Trinidad and Tobago. Furthermore, the Ministry of Health has embarked on an aggressive media campaign, which includes social media as well.
But are you worried though, Dr. Richards, that the situation is going to get worse, maybe especially involving children, before it gets better? Because I think just a couple of weeks ago, at one of those public accounts things in the Parliament, I think those who were responsible for providing school meals said that the children generally throw away a lot of the healthy options that are provided, and therefore when they provide those lunches, it's money going to waste, it's good food going to waste, and it's almost as if the children have already been conditioned into eating junk food.
Yes, I agree with you, and that's really, again, the message of behavior change, and those habits would have really developed from the home. So again, we would like to advocate that parents, really from a young age, start encouraging children to really have healthy diets. And in reference to your question about diabetes and the rate escalating, there is anticipated to have a worldwide increase in diabetes, and of course, Trinidad and Tobago is no less different from this.
And it seems that we're almost perfectly aligned with Western data, whether
Yes.
from the United States, because we eat all the junk that they eat as well.
Yes.
And Dr. Richard, in that sense, and maybe it ties in as well to the earlier discussion we were having with Shiraz, kind of the farmers that, eat local, buy local, eat more local foods and so on. I don't know how to phrase the question, but is it that because as a society that we've become so conditioned to imported food, packaged stuff, sugary stuff, processed food, that it's actually more difficult to change the mindset of the parents and the adults as well, and therefore I don't want to sound negative that maybe you and others are fighting a losing battle in this regard?
Well, I wouldn't go as far as to say we are fighting a losing battle. I will say, however, that it is an uphill battle and it is a significant challenge. With the price of modernization and urbanization really comes with the added implication of social diseases and lifestyle diseases, such as diabetes. And again, we really need to encourage that message of individual responsibility for persons living in our country. We really need to underscore the importance of choosing healthy lifestyle choices, whether or not you have diabetes, and if you do, then you really need to implement these choices. As far as parents are concerned, there needs to be a shift away in the behavior that encourages the use of processed food. Processed food is not only high in sugar, but tends to be high in artificial preservatives as well as salt content, which of course have other health implications.
If you have diabetes, if you've been diagnosed with diabetes, is that the end of the story? Can you lead a reasonably normal life even while you might have been diagnosed with diabetes based on a healthy lifestyle, cutting out smoking, or are you destined to suffer all of the complications that are attributed to diabetes?
Yes, you can lead a healthy lifestyle. One thing to remember is diabetes is preventable, and a healthy lifestyle is really encouraged by managing the diabetes. When we speak about managing, we speak about having regular consultations with your medical doctor and looking at testing for diabetes to encourage control. The benefits of a healthy lifestyle, such as the cessation of smoking, reduction in alcohol content, regular physical exercise, and a diet low in sugar, also encourage or promote persons to have a healthy lifestyle despite them having diabetes.
And we always see a greater attention towards all these health and fitness clubs and so on, especially around Carnival. People want to get fit to fet and all that sort of thing. But from your own perspective, whether you have any hard data or just from your own observation, are we actually moving towards a greater levels of health and wellness, not just in terms of physical health and so on, but what we eat and so on? Are you seeing any movement, any measurable movement in that direction?
Well, there's been a gradual shift in terms of the health-seeking behavior of our population. And really, we are seeing that by the presence of more gyms. You go to gyms in Trinidad and Tobago now throughout the year, and you tend to see a very full attendance. There's the corporation of corporate TNT and their involvement. There are a lot more health fairs. The Ministry of Health has embarked on mass programs such as Health in the Marketplace to really bring awareness to the population. In terms of a measurable impact, it may be a bit too early to really quantify any sort of positive impact, but we are seeing anecdotally such an improvement.
And before we conclude, Dr. Richards, as we talk about World Health Day and beating diabetes, if you could summarize, what would be your final bits of advice to the wider population, to those who have been diagnosed already with diabetes, to those who might be in the risk category, or just general population? What words of advice would you have for the wider population?
So I would encourage the population to really monitor their lifestyle choices, take individual responsibility for the prevention and treatment of diabetes. And I'd like to reiterate that diabetes is preventable, diabetes is treatable, and basically we want to stay super and beat diabetes in our country.
Dr. Richards, thanks very much for joining us this morning, talking about the issues related to lifestyle choices in the case of diabetes. And yes, you're going to run up against the big companies that push all the sugar, but these are the realities that you have to face as parents, and making those choices for your children. Sometimes it will be a little more difficult, a little more complicated to get the proper foods and so on for them, healthier foods, but the effort you make now could make their lives a lot better. The quality of life could certainly be a lot better and cost a lot less when you avoid all of the complications associated with diabetes, if you want to just think about it from a dollars and cents perspective. We'll take a break now and continue right after that.